Hello everyone, welcome back to my channel. Thank you for logging in. My name is Alex Mesheko. I'm your host. I'm a pharmacist, a community pharmacist, and we are here to just discuss some few things about our health. We are not here to diagnose or to treat sickness. We are not here to recommend drug. We are just here to discuss the missing link, especially after you have been diagnosed, you are undergoing treatment. What are the things we do that does not allow us to get good results after when we are undergoing our treatment, or even after the treatment course has elapsed. Now today we'll be discussing about ulcer. Last week I mentioned that ulcer is not a management disease. A lot of people come to the pharmacy, they come to the clinic, and they said my ulcer has come again. That pain that makes me not to sleep, the pain that is so bad that people cannot even do their day-to-day job. They cannot sleep, they cannot they cannot run, they can't do a whole lot of physical activities. They are really carrying it as something that is their own over the year. You have people say they have been treating ulcer for 5 months, for some months, and for years. It's not supposed to be so. If you follow the treatment guideline, especially the one that the prescriber will mention to you. And so what are we talking about? When you are treating ulcer, just ensure you take note of some of these details. Number one, most of the ulcer cases is caused by a bacteria, and the name of the bacteria is called H. pylori. Once it has been identified that you have this bacteria, a course of antibiotics will be given to you. Ensure you follow your medication. Use it for as long as they ask you to use it. If you use it for 5 days, for 1 week, and you stop because you feel relieved, which is usually the case, you will say, oh, I'm fine, there's no need to continue these antibiotics. Believe you me, the ulcer will come back again because the bacteria has not been eradicated. Ensure you complete your medication for 1 week, for 2 weeks or 3 weeks, whatever the duration of treatment given to you. Follow it through. And once you are done with the medication, please take the second test after the medication to check if the bacteria is gone or not. You need to do this, and you can actually do it at home. There is a rapid health check, H. pylori, which you can buy in any pharmacy, and check again and see if the bacteria is still there. If the bacteria is still there, you need to go back to your physician. But if the bacteria is not there, thank God, then you continue the next step of treatment, which will be for you to remain on another drug for like 2 months or more. And you have to keep using those drugs, because the idea is to ensure that the wound in your gut, either in the small intestine, in the stomach, in the large intestine, that the wound there is healed. And there are some conditions we allow the wound to heal. Those drugs that you take will suppress the production of the acid, or will dilute the acid. If you are given an antacid, which is supposed to actually go together, just use your medication. Use it long enough until you are fine and the wound has healed. But while you are treating your ulcer, if you are smoking will not allow this ulcer to heal. If you drink alcohol, especially gin, it will not allow it to heal. It will aggravate the pain. It will make sure that it will not allow you to get good results. And if you take some drugs, especially the non-steroidal anti-inflammatory drugs, talking of diclofenac, ibuprofen, pyroxicam, naproxen, all of these will not allow the ulcer to heal. So you need to avoid these drugs. There are drugs you can use. You have to use pain drug for people who have to be on analgesic. Maybe they have a condition that requires that, or you have pain. The ordinary paracetamol will do sometimes, instead of taking diclofenac. And if you have to take something stronger, there are modern drugs. There are drugs that is safe for an ulcer patient that you can use. Just talk to your prescriber, talk to your pharmacist. You'll be guided. Now, you need to avoid spicy food. You also need to avoid stress. Too much of stress, exposing yourself to stress. So I know we are in an environment where there's a lot of stress around us in Lagos, in cosmopolitan towns. In the city centers, we have stress around us. But you need to manage yourself. You need to know how to manage and control stress, ensure that you have enough rest, you sleep, and you don't give yourself too much stress. Fasting too is another thing you need to avoid. If you are treating ulcer, you need to avoid fasting for a long time. Too much of fasting will not help. You don't wait to be hungry before you eat. If you wait to be hungry, you're only going to complicate issue. You have to eat morning, afternoon, evening. Once you are having ulcer, it's compulsory to eat 3 times, at least minimum, so that there have to be food in the tummy. Once you do all this, the ulcer will heal and you'll be fine. And there's no need for you to say it is my ulcer and all of that. And when you don't do all of this, which a lot of people don't do, majority of the people that treat ulcer, they don't take note of all of this. They don't ensure that they adhere to the drug long enough. If you don't take note, if you don't do the proper thing, there can be complication. Perforation can result. There can be stomach cancer and a whole lot of other things that can come out from ulcer. In fact, ulcer can lead to death. So we don't want that. Please, ulcer can be managed and you will live and you'll be fine. A lot of people have been treated this way and they are good today. They came out of it completely. And so this is what I'm expecting, that everyone that have listened to this that have ulcer will have a good prognosis. Thank you, everyone. Thank you for listening. And today we have come to the end of the discussion. I look forward to see you next week. Please share my video, like the page, and subscribe. Thank you very much.